My name's Sheila Lloyd. I'm the Executive Director of Nursing, Allied Health Professionals and Governance here at the Black Country Partnership Foundation Trust. I'm really proud and very privileged to be in this role and working with our really passionate staff, our staff who care immensely for our patients and our clients. I really welcome the introduction of the 6 C's to the Black Country Partnership. The teams have been working really hard and they're clearly demonstrating these core values within our organisation. As part of the Black Country Partnership's work with the 6 C's, we've also started to work with our Royal College of Nursing on cultural alignment. There is a pilot going on nationally and we are part of that pilot with other provider trusts, but also working with NHS professionals and the NHS Leadership Programme.
I think the 6 C's fit really well with the professional values of doctors. They are well aligned with GMC requirements.
The 6 C's, as I've said, isn't just about clinical relationships and your relationship with patients and what that means to them. They should also be thought about in relationship to our staff within corporate services and our support staff within the division, because what we do know from research is if people are treated with dignity and respect and compassion, then you're going to get the best out of your workforce.
Part of my role is I'm here to care for people on a daily basis in any element that they need my assistance. Taking care of somebody from the physical health perspective, a mental health perspective. It can also be other things to do with, you know, finances, the law, the police. It can be a variety of different things, but we're there to care and assist and help with any eventuality.
Care is the close attention or concern for another.
Patients and staff should all be treated as we'd like to be treated ourselves.
Caring is about providing good quality meals for both patients and staff.
You cannot provide safe services without caring. So you have to care for somebody to actually ensure that they're safe.
They only take a minute to make, but it makes the patients feel warm and welcome.
We're communicating better. It makes sense because we're doing more work together.
And we've been having what we call our band days. So we've had a selection of band 7 clinical staff, nurses, allied health professionals, so our OTs and our physiotherapists. We've also seen our band 6 staff for the day. We've had time out with our band 5 staff, and then our non-registered staff, which was our healthcare support workers and other support workers for our professional staff.
Communication is central to caring relationships and effective team working.
Communication is a way of communicating to our patients in order for them to understand about their care, whether verbally, non-verbally or using the pictorial system.
Our main focus is to communicate effectively within our MDT team here at Pond Lane, which has actually improved the care of the patients significantly with some excellent outcomes.
So commitment is about taking pride in what you do and going the extra mile to help other people.
Commitment is about having a common purpose which is based on quality and making sure that the patient and their families, their needs are met.
And it's rewarding when you see that smile when they take their first walk. It means that you're doing something right, even though that patient can't communicate with you. A smile is an achievement.
Not only do I have to be competent in my own role as an occupational therapist, but I also assess and maintain the service users' competence and abilities in their daily tasks and activities of daily living.
It also involves having the competencies to know where and how to report, how to raise the concerns. So you have to have some level of competencies in terms of safeguarding.
Our clinical teams are second to none, and I'm really, really proud to work in the Black Country Partnership Foundation Trust.
When you're interacting with them, it could be through music therapy or on a one-to-one or a simple tactile hello. You're connecting to that patient. They can't communicate with you, but that touch and that smile is a big thing.
I've watched our staff demonstrate our core business care, and they provide excellent care with compassion.
I've used so many services with the NHS, but also not only with my health problems, but with my problems at work as well, learning to get around, having the courage to apply for a new job after being made redundant, fitting into a new work lifestyle. It's been quite difficult at times, but you don't know what you can do till you do it.
For allied health professionals, that is occupational therapists, physiotherapists, speech and language therapists and dietetic services, courage means challenging poor practice, challenging our own practice and that of others.
All the 6 C's are important, but I guess courage is the one that I'm particularly drawn to. It's about doing the right thing, especially when that's not easy to do. We know we're going to have some really testing times ahead in the NHS, and our values will be tested. It's going to be really important to show courage, whether we are a board member or a healthcare support worker. And showing courage will be about doing the right thing. And doing the right thing has to be about remembering that we are only here to serve the people who need us, who come to us for help.
Courage is important to me. People must have the courage to stand up and be counted.
Hello, my name's Joyce. You've heard a lot about the 6 C's, and the 6 C's are fundamental to everything that we do here at the Black Country Partnership Foundation Trust. Building on the 6 C's are the 6 C's action areas, and as an organisation we're 100% committed to ensuring that our patients' well-being and our staff are looked after and cared for, that we have the right staff with the right skills in the right place, and we're doing a lot of work around that, and ensuring that our patients have a real positive experience of care, and their families and their carers when they come into this organisation. And we must have the courage to ensure that when things go wrong we speak up, we share with our families, and we're committed to make sure that things are put right. It's important that we have the right leadership, and by that we mean leadership at every level. So we're all leaders and we all have a role to play, and we all contribute to ensuring that we get good patient outcomes and that our staff feel valued and want to work within this organisation for the benefit of patient care. Thank you.